just want to remind everyone just to turn off their cell phones or turn them on silent if you haven't already. Myself. Okay, Virginia, you can go up to the podium and we're going to start here. Okay, ready? We can start the live.
Good morning. I'm C. Virginia Fields, President and CEO of the National Black Leadership Commission on AIDS, a nonprofit organization whose mission is to educate, mobilize, and empower black leaders to address the issues of HIV, hepatitis C, and other health disparities in their local communities. And today, of course, is July 25th. And this is National African American Hepatitis C Action Day. The National African American Hepatitis C Action Day was launched in July of 2013 by the National Black Leadership Commission on AIDS in partnership with the Harm Reduction Coalition and the Coalition on Positive Health Empowerment. The purpose of this Action Day, first of all, is to raise awareness about health care among healthcare professionals, policymakers, and those at greatest risk about the significance and impact of hepatitis C virus, HCV. Secondly, it is to educate and empower leaders to mobilize within the Black African American community and to encourage testing and engage policymakers to advance HCV routine testing legislation. And you will hear more about the statistics and the data as to why it is so important to focus our activities on the African American community. And today, actually it started last year in BLCA, as we are known, began working with local health partners to address the hepatitis C epidemic in the South by expanding HCV screening with the OraQuick HCV rapid test in public and community health settings, ensuring patients immediately receive their test results and are linked to care. Joining with community stakeholders, the Southern Initiative is launching in 4 cities: Tuskegee, Alabama, New Orleans, Louisiana, Columbia, South Carolina, and Baton Rouge, Louisiana, to demonstrate program effectiveness, collect and utilize data to educate community leaders and constituents. The initiative will also educate and mobilize community leadership to respond to the barriers and restrictions that limit access to hepatitis C screening for their constituents. The Southern City Hepatitis C Test and Link to Care initiative is made possible in part through community-based outreach support from the FOCUS program, which is a Gilead Sciences program to help ensure access to screening and care services for people living with HIV and HCV. So we're very pleased to have you join us this morning as we delve further into the epidemic, its impact within the African American community, and why it is so important that we focus this initiative in the South because of the growing numbers. And to get us started this morning, we have several speakers. We are awaiting one, and as soon as our senator joins us, we will certainly introduce him and have him speak. But at this point, we also have a very, very important person to join us, who has already joined us, an activist, an AIDS activist, founding director of the Divinely Inspired, Victoriously Aware Foundation, known as DIVA. The DIVA Foundation was founded in 1990 as a living memorial to the many friends she had lost to HIV/AIDS as an original cast member on Broadway's Dreamgirls. And because of her concern for the threat HIV/AIDS posed to women and children. Not only is she an American actress and singer, seen on shows such as Ray Donovan and Instant Mom, she's also a passionate AIDS activist. And I am very pleased to call to the podium to provide some remarks this morning, Sheryl Lee Ralph.
Good morning.
Good morning.
Anytime I always speak, I always bring the statement in song. I am an endangered species, but I sing no victim song. I am a woman, I am an artist, and I know where my voice belongs. I know where my voice belongs, and it is not one that I have felt any need at any time during the fight or raising awareness against HIV and AIDS. For me, many of you know it has been a 35-year voice that has been heard around the issue. Not 30, not 25, 35. That's right, look at me. I look good for being in the struggle that long. Thank you. 35 years, because 35 years ago, I saw my friends drop dead of a mysterious disease, and it was horrible how America, the world, came to or did not come to my friend's defense, which is why I used my voice, because I knew where my voice belonged. 35 years later, 35 years since that first HIV death, 35 years later, I lost a dear friend to Hep C. This woman stood right here with me every year when we were doing Diva Simply Singing, which is the longest consecutive running musical AIDS benefit in the country. But she stood with me, she sang with me, she used her voice with us. And last year, December, we lost Natalie Cole to complications of Hep C. Natalie Cole tried to let people know how important it was to not only know your status around HIV, but to know your status around Hep C. She wanted people to know that if you're African American, well, most of us know you're twice as likely to get anything more than anybody else. And included in that is Hep C. So just like a day of awareness around HIV is important for everybody, including African Americans, a day like today is important for African Americans around Hep C, because I don't know about you, but I think that Hep C and HIV are kind of like fraternal twins. They're definitely from the same package, they just don't exactly look alike. But I have hope. You see that we have all these different treatments and cures. Some of them have not been harmonious, but I'm happy that they are there, because it gives me hope that maybe we might be just one step closer for a cure for HIV. Because I see the possibilities with Hep C. So I hold out hope and deliverance for HIV. So I'm happy to have all of you here. In some ways, I am your FLOTUS for Philadelphia. Yes, I am married to State Senator Vincent Hughes of the 7th Senatorial District of Philadelphia. He is also chair of appropriations also known as the big boss with the hot sauce. So I welcome all of you to the city of brotherly love and sisterly affection, and I'm happy that we are launching this here in Philadelphia because God knows we need to raise awareness. So I remain also your diva, divinely inspired, victoriously aware. I am Sheryl Lee Ralph, and you can call on me, because that's my friend, that's my friend, that's my friend, that's my long friend, and that's my friend, and because of him, that's my friend. So, because of all of them, you're all my friends, and welcome to Philadelphia.
And thank you for helping us to know where our voice must also belong. Sheryl Lee Ralph, thank you so very, very much. HCV disproportionately affects African Americans, and in an analysis of the data from 2003 to 2010, African Americans accounted for 11% of the population, yet represented some 25% of those living with HCV. Up to 75% of individuals with hepatitis C are unaware that they are even infected. Today, there is a cure, but you can't be treated or cured if you don't know. And that's why I am so pleased to be joined this morning by a group of panelists who will talk to us about the work that they are doing to get people treated, cured, and to know, first of all, that they are in fact living with HCV. We have a terrific group of panelists who are doing the work and in other ways involved with the Southern Initiative that who will come to us and talk about what they're doing. Our first speaker is the Honorable Donna Christensen, a medical doctor who received her MD from George Washington University School of Medicine. She served as a member of the United States House of Representatives from the Virgin Islands from January 1997 until January 2015. Donna, the Honorable Donna, served as chair of the Congressional Black Caucus Health Brain Trust Committee and did phenomenal work there. Please welcome the Honorable Donna Christensen.
Thank you, C. Virginia. It's really great to be here this morning with everyone, and want to also add my word of welcome to the DNC convention. And it's very appropriate that we're doing this here today. You know, in addition to being a physician and, of course, having chaired the Health Brain Trust, I've been in the health equity movement just about all of my adult and professional life. And hepatitis C in African Americans, and I might add in our Native American population, because we don't hear much about them, is surely a health equity issue. It is surely a health equity issue, so there's no way I wouldn't be a part of this vital effort. There are more deaths from Hep C in this country than from all of the other 60 reportable infectious diseases combined. That's a staggering statistic. And nowhere is this more critical that we address this than in the South. And today we're taking action with the Southern City Testing Project. I'm here representing Hepatitis Foundation International, and my CEO, Yvonne Fuller Cameron, is here joining us and just demonstrating how fully we are in support of this project. And we have our particular mission, which is to reach the hard to test and the hard to treat. So we're in complete alignment with this project today. The hard to reach and the hard to treat include, of course, racial and ethnic groups, injection drug users, substance misusers, the incarcerated, Medicaid recipients on whom we're doing a study right now, veterans, the homeless, and others. So if you're African American and in any of those other subcategories, the risk is really staggering for us. Hepatitis C is at least twice as prevalent among African Americans. Research has shown that African Americans are more likely to be diagnosed later. This is in everything, but it's also true in Hep C, and reflecting missed opportunities for prevention. In 2013, the rate of HCV-related deaths in African Americans was twice that of whites. And here's a very important statistic that speaks to why we're here today. If HCV was eliminated from the African American community in the United States, we would see a reduction in overall hepatitis cases of up to 23%. So it's clear that we all have a responsibility to take action on this National African American Hepatitis C Action Day. Doctors and other providers need to educate, vaccinate where possible, screen, and OraSure has made it very easy and accessible for us to do that screening, and refer to treatment and care, as the Southern City Testing Project is going to be doing, and is already doing. The pharmaceutical companies really have a responsibility to make their drugs available, accessible, and affordable. Those already infected should make sure that they prevent its spread and remain compliant with treatment. Politicians and policymakers, they have a role to ensure that prevention and treatment and care get the needed support, not only in policy, but in funding and financing of those entities, and to work to change the social and the economic environment that fuel these diseases and put minority populations, African Americans and others, at high risk for all of the diseases and illnesses that create the health disparities. And all of us have a responsibility to stop the stigmatizing of individuals with hepatitis. We would be negligent if, with all we know and all the tools that we have, we do not take action to eliminate hepatitis C from the African American community and all of the communities that are burdened by it. So on behalf of HFI, Hepatitis Foundation International, and I'm going to take the liberty, because I do consult with Gilead on their access programs, to include them, and I'm a National Medical Association member, to say that HFI and the others are in full support of the Southern City Testing Project, and we look forward to working with OraSure, Gilead, Focus Program, and all of the wonderful people who are doing the work on the ground. So thank you, and I'm looking forward to hearing from you.
Thank you so much, Honorable Christensen. And there will be time, we hope, for a few questions, so, and she will remain here with us. The other point we want to make, too, with respect to African Americans, it has been shown, based on the research and data, African Americans, the baby boomer population, those of us born between 1945 and 1965, are most disproportionately impacted. So as we go through this, let's keep that in mind also. Our next speaker is a person who maintains a passion for education, particularly among adolescents and young adults, and seeks to address their sexuality issues, as well as create strategies that reduce the negative consequences of early or irresponsible sexual involvement. She is a published individual, having written many articles, and currently is the executive director of the South Carolina HIV/AIDS Council in Columbia, South Carolina, Dr. Bambi Gaddist.
I love technology. Good morning.
Good morning.
First, I want to extend my appreciation to Gilead Sciences, to OraSure Technologies, who are innovators. I also want to thank Sheryl. She's she doesn't know it, but she's been a mentor, and the opportunity that I had to travel with her to South Africa was life transforming. Our agency is 22 years old in July, and I never thought that I'd be here at this point in time. Community-based organizations are going through an interesting time as we transition into affordable care. And so our agency, like many, are in a transition, and we're looking at how we're going to rebrand for the future. And so when we think of what direction are we going, as a organization that serves a population that's predominantly African American, we are excited about this opportunity like no other time. We have about, that we know of, over 70,000 cases of HCV in our state. We have no idea what it really looks like. Our HIV epidemic has traditionally, for the last 35 years of this epidemic, been predominantly African American, with young gay men of color, who is certainly a group that we must target, along with baby boomers and some other key populations that we are seeking to provide services and allow them an opportunity to find out whether they're living with HIV, particularly youth. In our state, we have some particular barriers that continue to play out even after we diagnose individuals with hepatitis C. Some of the policies and regulations that currently are in place actually deter people from getting access to the treatment that they need so desperately. And so that's part of our education as well, not just about knowing your status, but knowing what is it that we need to do to enhance access. We have some structural barriers. We are a non-Medicaid expanding state that has, this is meaning that we have over billions of dollars that would never and will never come into our state until we see a change, which will impact access. The health disparities that you see before you have been chronic, but we've made progress. But there is so much more to do, particularly when we look at our young people and the platform that we're staging right now as we discuss comprehensive school health or the lack thereof. And so it's not unusual that we see young people coming into our office between the ages of 20 and 29 testing positive not just for HIV, but Hep C and other sexually transmitted infections, which we're trying to address and will be able to with the resources that have been provided for us for more outreach. Some of the assets that we have is that we have the only mobile unit in the state of South Carolina, which gives us an opportunity to go into neighborhoods that we typically cannot get into. We need more of that. We need more opportunities, particularly in rural communities, to get this word out about hepatitis C. Our clinic, Right Wellness Center, it was just opened recently in the last several years. It has been transforming and getting people not just to test, but we've got to link them to treatment and to competent and culturally competent providers who understand not just the disease, but understand the people that they're serving. And so our plan for this hepatitis C expansion is somewhat multifaceted. First of all, our goal is to enhance and create new partnerships. Our goal is to create a model that really looks at this unspoken population about persons who are incarcerated, persons who are formerly incarcerated, who get very little attention, and who are, in fact, because we're not testing on the way in, because people are hesitant to deal with the financial burden that they're going to have to endure. Our conversation is moving toward what would it look like if we would, at the minimum, test on the way out, so that we know what's coming back into the community and how we can link these individuals to care. And then the third priority area deals with engaging young people. Most of you know that, I know in our state, we just recently passed laws related to tattooing. But as you know, there are regulations and there are non-regulated tattooing. And we are particularly concerned about the HCV transmission rate that is potentially there and is showing itself because people are engaging in unregulated tattooing. You'll see here that Gypsy Moon, I gave Josh credit because he's the first person to sign on to our initiative. And I made it a point of saying that if we want to push this HCV agenda, we're going to have to partner with local communities and give them the props that they deserve. So what you see here are a multiplicity combination of entities that we're planning to partner with. Some of these people we have already begun, methadone clinics, and people who may now be in their livelihoods and professions, but back in the day had a life that placed them at risk for HCV, and they're still living it out. but you'll see other mental health, aging, centers for detention, and others, including veterans. And so as a final reflection, we can't just test, we have to link to care. We have to find these providers, and that is one of our biggest challenges, building relationships. So some of the groups that we're looking at now are people, given the opiate addictions, we're looking at how do we link with people who help manage pain, where we looked at the outcome of an addiction, but it started with a back pain or something that we thought was normal. We want to interface with gastrointestinal physicians because they are treating HCV, and we want to build a cadre of them who will support us in our efforts. And then we want to make sure that we have an active referral list so that we're not just being passive and sending people who already have a host of issues they're confronting. We want to walk with them and partner with them to get them there if we have to get them into the right place. So we are fortunate, very fortunate, we believe at our agency to have this great opportunity, and we just think and look forward to partnering with our colleagues as we come up with new innovations. Thank you.
Thank you so much for that very, very informative presentation. And I hope all of you heard when she said they have the only mobile unit throughout the state of South Carolina. And with many of the areas being rural, reaching those areas continue to be a big, big challenge. Our next presenter is Tamara, Pierre, who is the founder and chief executive officer of Priority Health Care, a nonprofit 501c3 organization located in Mobile, Louisiana. Since 2009, she has worked to address the health care and support service needs of the underserved population in Louisiana, while providing specialized services for people living with HIV, AIDS, and now more specifically, hepatitis C. Ms. Pierre.
Good morning. Good morning. Okay. Oh, wrong way, excuse me. So our project is called Hep Connect, but I want to kind of give you a little insight into what's going on in Louisiana. So since 1990, Louisiana started tracking the number of acute and past and present Hep C cases. So we have right now over 90,000 cases that are documented. And then each year we're seeing that number increase by up to 500 infections a year. And if you notice over the last 15 years, you'll see the information on the screen. It shows we've tripled the number of hospitalizations that we've had of people with Hep C. And on an average, we're seeing about 204 people dying because of Hep C complications. And in Louisiana overall, the main areas that are infected with HCV is New Orleans, the Baton Rouge area, and Lafayette. And all across those areas, we see the commonality is among African American males between the ages of 45 to 54, with injection drug use being at the main source. And as a lot of places also, we also see the correlation between Hep C and HIV. And in Louisiana, we're fifth highest in co-infection rates overall when you look at the nation. So in Louisiana, we've put some plan of action in place. One of the things at the state level, what they've done, there's a coordinator who works with community planning groups at the city and state level, engaging, letting them know about Hep C, the importance of getting people tested, getting people aware about the infection. Also, there is a coalition, HCV coalition, which is made up of community health centers and primary care providers that are working on addressing the awareness needs and access to care for the patients. The other thing right now, as far as the community health centers in Louisiana, we have 34 community health centers. Only 9 of them are actually providing treatment and care at their centers. So we're still working in that area to try to get that expanded. So the linkage to care and retention part, that's something that we haven't had at the state level. So we really welcome and thank Gilead Sciences for the Focus Initiative. It has allowed our organization, as well as some of our community partners, to provide the HCV rapid testing in the community. And that brings me to where we are now as an organization. We've partnered with Gilead in June of this year. So our Hep Connect program is focusing on people living in the 8-parish area in Region 1, which is inclusive of Orleans, Jefferson, and some of the surrounding parishes that we provide testing. So with our Hep Connect project, we actually have 6 components that we focus on. The first and foremost important part is our community partners. In order for us to go into the community settings and offer testing, we have to work with those that are in the community, such as tattoo parlors, substance abuse facilities. One of the major ones that we've just recently signed a collaborative endeavor agreement is with the parish of Jefferson. In Jefferson Parish, they have 9 community centers where they provide housing classes, rent utility assistance, food bank services, Head Start programs. We're actually going to be providing HCV and HIV testing at those sites. The other part of it is the outreach team. These are actually the staff members that go out in the community, provide the testing, bring the awareness to the tattoo parlors about HCV and other community sites as well. And then the main part about that, of course, is linking them. One thing is identifying persons that are positive, but actually getting them to the care that they need. So that linkage person is responsible for addressing any barriers. A lot of our patients, sometimes they cannot afford to get to their appointments, so we provide bus tokens or whatever means of transportation they need to actually get to their appointment. Now, we all know the cost and treatment is very expensive, so along with getting them to the clinic, one of the things we offer at the clinic setting is an assessment. Louisiana has expanded Medicaid. We are so excited about that. That actually happened this July. So that really brings a lot of opportunities for our patients that haven't had those opportunities before. So with that linkage to the clinic, we have somebody that assesses them for any of the Bayou Health plans, which is now Healthy Louisiana plans, or the Affordable Care Act. If patients cannot afford the care, everything is offered on a sliding fee scale. We're now a community health center, so everything is offered. If the patient cannot even afford it, we make sure that the patient receives the care that they need. Along with that, the next component is after the patient is seen by our physician, the next step is a healthcare coordinator. As you all know, the treatment is very expensive for Hep C, so we have someone that works with the pharmaceutical companies. If a patient does have insurance, they also have to work through the process of getting it approved, which can be a lengthy process. It takes over 30 days. But we have that person working with the patient because we don't want people to get discouraged in the process of seeking treatment. And then our last part is our in-house pharmacist. So he's really working closely with the healthcare coordinator to address any barriers with getting the medications for the patients. So, and that's just the end. But I just want to kind of share with you the whole idea about Hep C and making sure that it is provided to the treatment is provided to the patients that we see. We as a community, we have the right, we must care for each other. We have a lot of people in our community that do not have the resources, do not have the income, and that's why we are here. We are the speakers and on the forefront for those patients. So I just want to thank everybody. I really appreciate Gilead partnering with us on this initiative because overall, our object as a community health organization is that we want to improve the quality of life of the people that we serve. So I thank you for your time.
Thank you so much. Our next speaker is Wendell James, who serves as Assistant Director of the Baton Rouge Black Alcoholism Council Metro Health. This is an organization that develops and implements educational strategies to reduce the spread of HIV, AIDS, and other sexually transmitted diseases. Working in community-based organizations for over 20 years throughout greater Baton Rouge, Louisiana. And we welcome Mr. Wendell James.
Good morning. We also like to thank Gilead as well as Orshire for bringing us out here, and thank you for the initiative. The first thing we want to do, we want to do something different, and that's one thing about HIV screening beyond the clinic walls. And that's one of the things that I wanted to see done because every time you look at different things, we also have treatment for that. We thank God for providing risk reduction counseling and testing for HIV, HCV, and STD for individuals in the institution as well as community settings. And we want to promote early HIV, and STD testing. And want to motivate behavior change in people who are at risk for becoming infected with HIV, HCV, and STD. And we want to also increase awareness of HIV and HCV and hepatitis and STD prevention services through workshops, seminars, presentation, and counseling. And one of the key things is render service for persons for looking into care for us infected with HIV, Hep C, and STDs as well. Why screen now? HIV screening can be easily integrated successfully into the HIV screening process. We have a mobile unit. HCV is up to 5 times more prevalent than HIV. More than half of individuals with HCV are unaware that they're infected. We found that out. And one of the things is to develop and inform in the field. We don't have an idea of for the extent of HIV and HCV in the Baton Rouge area. That's one reason why I thank God for us coming out here to get more knowledge so we can find out. And one of the things is we try to look at, because one of the things that we see is the higher number of cases reported in Louisiana is from New Orleans and Baton Rouge, Louisiana. And then the new treatment provides cure, simply use regimens with low toxicity. Where we test that, it's important that we test outside the healthcare settings, and as Louisiana has one of the high rates of uninsured patients, and who do not access healthcare until they're very ill. Therefore, we're screening at the following institutions, community health centers, and settings. And one of the things that we try to get involved with is the East Baton Rouge Parish Prison. We're located in the West Butler Community Center, which our office is housed in 2 zip codes. Another thing is the Capital Area Recovery Program, which we have a lot of clients coming from incarceration to a point. A lot of them was injecting drug users. Now they're trying to get back into society again. We try to give them a fresh new start. And by doing that, we also go in high-risk communities using our mobile unit. We go out there at least 3 times a week, providing screenings for HIV, STD, affordable, which is free. And I thank God for that, which is a blessing. And you start seeing a change. And we want to do now, we're trying to increase it. We just started the grant. One of the things that our goals are to increase HCV testing to 900 per year. That's one of the goals. They refer to clinical partners at least 80% of the persons positive for RNA confirmatory testing and link them to care. Doing testing is great, but when you link them to care, that's the benefit of everything. And by having 2 partners, which is the Caring Clinic, as well as Care South, we sit and talk with them. They'll do the other test, the HCV screening process. And within a few weeks, within a few days of really launching it, we started Monday. And we tested 11 people, and we got 4 positives. And that's in the Baton Rouge area. And that let us know right there that that's a greater need for us to go ahead and test more people for Hep C. Right. Especially when you're located in a minority-based community, where a lot of things continue to go on and stuff like that. And we want to, we just thank you all for having us out here today. If y'all need anything else, just give me a call, information on here. And I apologize for the numbers.
Thank you so much. Such exciting presentations about the work that's taking place. Thank you so much. We still have one more speaker, and that is Dr. Anthony Lee. Dr. Anthony Lee is at the University of Alabama School of Medicine, Division of Infectious Disease, where he has oversight for the statewide hepatitis C test and treat program. At the University of Alabama, Birmingham, he has been a training instructor at the Sparkman Center for Global Health and has managed the AIDS Education Training Center in Alabama. Dr. Lee.
I'm honored to be here. Thank you very much to the sponsors, Gilead Focus, to the conveners, Orashore. I recognize a lot of friendly faces, and also my hepatitis C team in Alabama for representing them. I was in a similar event a couple of months ago. I was invited to talk to a congregation of missionary Baptists, about 200 black ministers. And I, being in the classroom setting, I posted a simple quiz. And the quiz really relates to this one drop of blood. And it was a trick question. And the question really was this. What's the major mode of transmission for hepatitis C? True or false? Sexually transmitted? And everybody raised their hands. True. There is a myth out there and a stigma out there. And most people don't know the major mode of transmission. And you all know, I know that. I also assumed that all the ministers knew that too. And I was actually surprised that most of them actually, there was one or two hands that were shyly up, and they were actually the right ones. That it's not a major mode of transmission. It's actually a blood-borne disease. So the moral story is that most people don't know. Cut forward to me being a novice in hepatitis C in a clinic setting. With a patient coming in, 64-year-old male, and was diagnosed of hepatitis C, cirrhotic, and he was in disbelief. It can't be. I haven't done anything. That's risky. And the wife was there and chimed in. He lives a normal life. Why would he be having hepatitis C? And for that matter, being cirrhotic as well. And so we probed and found out that, well, in his early 20s, he had been experimenting with ID use, injection drug use, and of course, sharing with his friends. So the moral story here, I guess, is don't share a bloody thing. You can share in the immediate age, but not this bloody. The other moral story is this. When I go around the state, and I go and I feel like I'm a traveling salesman, peddling this service, sometimes for free. And most time I get this. I don't need it. There's nothing wrong with me. The thing, another moral story is that not only do people not know how it spreads, most people don't know they have it. So here's one of my favorite slides. And that's how I kind of convince them over. We care a lot about looks. We are a very, very surface society. If this was your liver, you'd be like, okay, let me go and do some cosmetic surgery and spend all this money, but when it comes to your liver, what you don't see, you don't worry about. So I'm glad to say that in Alabama, we have been fortunate. We were funded to do this project a year ago before this community test and treat program. In the last year, we built up an infrastructure. We are, I believe, one of 4 states in the country officially that is being funded to manage and treat hepatitis C in a primary care setting. And we know that there are a lot of challenges. One of the, in South Carolina, you mentioned that treatment is a big issue. There are all kinds of barriers, I can get into that, but one thing that we've tried to do is not make it a specialty disease. Put it out in the community, in a very qualified health center, allow people to be treated, to be managed. We have coordinators that link people for compliance, navigate the healthcare system, make sure they get the medication, and get cured in all the major cities in Alabama. So this, our project is called Active C, Alabama Coalition for Testing, Intervention, Engagement in Hepatitis C Care. It's a mouthful. I never remember that. All I remember is we test and treat. That's the main thing. So the community test and link is a very nice complement. I liken it to 2 sides of the same coin. We have been in the community setting. We've not been in the community setting, we've been in the clinic setting doing this. So I'll focus on, since I'm here to talk about the community test and link. The nice thing about linking, testing in the community is that these kits allow the patients to know the results there and then in 20 minutes. Yeah. And they can then be brought into our coalition for further confirmation with an RNA test. we've also built in some kind of subsidy to motivate these folks who are uninsured to go into these clinics and get the test done and subsidize them for the lab costs. We put a ceiling to that, but for the most part, if the clinic is cost efficient, it should be free for the patient who's tested positive, for the uninsured. And then once they get linked to care, our operation takes over. They get screened in the clinic. We also do screening in the clinic, and since we were talking about numbers earlier on, statistics are all over the place depending on who you quote. I mean, for example, since we're talking about the African American community, one of the things that's striking is that in the birth cohort, it's actually 3 times more likely. The prevalence is about 3 times more than the general population. If you're just African American, it's twice as much, but if you are in the age cohort, it's 3 times as much. In our clinic sites, I'll give you another example. In Birmingham, in one of the federally qualified health centers, it's about close to 1 in 2 that we tested that are positive, 40–70%. But it's also in a very impoverished area with a lot of injection drug use. So just bear that in mind. You can manipulate statistics all you want to, but the bottom line is that we have a great need. And so as we turn over the stones, we realize that our prevalence is much higher than any published statistics. And of course, Alabama is also a rural state, bearing that in mind, with a lot of health inequities. One of the nice things about our coalition is that we actually have a centralized case manager to troubleshoot any kind of insurance issue, navigate the barriers. We also have the coordinators making sure that they track the application status, the compliance for medication. Surprisingly, if you're uninsured these days, it's actually easier to access the $1,000 pill medication than when you're insured, even under Obamacare. Even if you're insured, Blue Cross Blue Shield, for example, have ways of rationing so that you have to have, for example, a fibrosis score of so many, and they don't pay for the test, and then, so good luck. If you have insurance, you don't get medication unless you meet these advanced stages. This is just another way of showing how we implement the algorithm and give guidance to our community partners as well as to our clinics for treating that. And the line here simply means our 1-year-old operation takes over. This part here simply says that the other side of the coin of community screening comes into play. We have partnered with organizations statewide. Our focus started off with Tuskegee because Tuskegee was a very underserved area. So we have partnered with the Office of the Mayor's Office, joining forward together with a whole bunch of other stakeholders that is out here. In other parts of the state, we are partnering with also very qualified health centers. I gave some examples, the acronyms. You probably wouldn't remember them, so I wouldn't even say them. We also partner with the State Health Department. We actually fund them for, believe it or not, our State Health Department. This is how unfunded the disease condition is. The annual budget for the state government from the federal government, and they don't have to get any state funding, is $95,000. So for a disease that is killing more than HIV and any other infectious disease combined, someone said that early on. Yeah. So we have 95,000. So we fund them to do the surveillance part, and we actually are trying to build up a surveillance infrastructure. We also partner with AIDS service organizations throughout the state, and they do a lot of outreach activities in inmate population, in drug rehab centers, and then we bring them into a system. And we also are partnering with churches to actually convene this community screening. To end, just to reinforce the point that a majority of people, 3/4 of people who have Hep C are born in that birth cohort. So as much as we preach Screening birth cohort. I will tell you that culture change is a difficult thing. And we are still trying to get clinics to screen systematically. And again, bearing in mind that people don't know how the disease spreads. People don't know that they have it. And we need to do a better job going out there. Thank you very much.
Thank you. Thank you so much, Dr. Lee. And as I look up, I see that we have now been joined by our senator here in the state of Pennsylvania. And of course, we heard earlier from his illustrious wife that he has been a member of Pennsylvania Senate for over 20 years, first having been elected to represent the 7th Senatorial District in 1994. He was elected in 2010 to be the Democratic chair of the Senate Appropriations Committee, the money people. And he has, throughout his term, been a driving force in addressing healthcare disparities within the African American Black community. Please welcome the Honorable Vincent J. Hughes, State Senator.
That's the big mic right there.
That's the big mic.
Good morning. How's everybody? Good morning. Oh, y'all you haven't had your coffee yet. Good morning. How's everybody? Very good. Very good. Very good. So, first order of business, spend lots of money. All right. All right. First order of business, as a representative of the city of Philadelphia and the Commonwealth of Pennsylvania, spend lots of money and spend it, most of it, in the 7th Senatorial District, which is where I represent. All right. Not too far. I can give you great ideas. Let me just say this. After already a very busy morning, numerous TV and radio interviews, gatherings already with the Pennsylvania delegation and other delegations around the country, all within 3 hours, okay? My last conversation was with a radio station, a local radio station here, WURD. Some of you may be familiar with it who are from this area. And it has a specific and a particular focus on, as it's an all-news, all-talk kind of radio station, 24 hours a day, African-American owned, one of the few in the nation. My last conversation with them is, well, what is all of this about? Is this just about parties and folks hanging around, this whole DNC thing, and what is this all about? And what we said to them is that, yes, of course, any convention has lots of celebrations. Any convention, any gathering has lots of parties, lots of folks coming together. That's part of unifying whatever group that may be. But our responsibility is to add a lot more substance to the partying, okay? Which is why I'm really glad when my scheduler provided me my 36-page list of things that are going on this week, about 100 or so different related activities, that I saw this, and that in fact on this, the first official day, this is my first official stop, okay? We had the opportunity to gather folks from around the nation to lift up issues that other folks don't want to talk about, okay? Other folks still shy away from. Other folks still, get a little crazy about. And working with this organization, with some of the folks who are in the room, and actually being here in Philadelphia, knowing that as we do the public outreach to educate folks around prevention and what have you, that we also are one of the fastest growing areas of technology and innovation in the nation, here in the city, and it just happens to be in my senatorial district, okay? Just happens to be. And we try to encourage that as much as possible, because that innovation, that technology has the ability to take something that is very much life-threatening and if not make it manageable, at the very least, make it easier to live through. We found that through the HIV experience, okay? And we've got to change that and utilize that through other issues. But the other thing that has to be said is that it is our responsibility always to make sure that there's substance put in the larger dialogue. We're going to go to meetings all over the place, and my congresswoman would say it's going to be talking about campaigns and how do we win elections and who's organizing it. And with all this analytics that are going on these days, the old days, that stuff that we used to do back in the day, that's ancient, okay? The way they're analyzing people and they're analyzing vote patterns, are you going to have a latte today or are you going to have a iced coffee this morning? They're analyzed to that level of depth. But what is it for? For what reason? If you are not advocating an issue or principle of consciousness that's going to transform people's lives, what's the point of running for office? Or are we just the same as the other guy? Just that one is blue, the other's red, okay? So it's always important to have these kinds of conversations and to manifest them throughout the entire week that we're going to be here. So I thank you. You've got my dream girl here, okay? All right. Maybe a bunch of y'all dream girl, but I'm mine. I put a ring on it, baby. I put a ring on it, all right? Show the people, Thank you very much. You got her, and of course, she's always got something going on. She convened, so we have this, and I'm going to finish up here. We put together a, just decided with about 2 weeks' notice, a forum for this coming Thursday, and all of you are welcome to participate from 10 a.m. to 1 p.m. A new deal for a new America, a new deal for a new urban America, jobs, wages, economic opportunity, and the revitalization of distressed urban communities. And so that's from 10 to 1 at the Arch Street United Methodist Church at Broad and Arch Street, 1 block north of City Hall. It's open to the public. We've got about 400 people going to be there. Good friends of ours are going to be participating. Mark Morial, Reverend Jackson, Jesse Jackson, all kinds of folks are going to be participating from all over the country. And so Sheryl looked at my schedule for the week and she said, well, what am I going to do? I said, well, what do you want to do? Okay? She said, she thought about it, and it doesn't take long with her, all right? So 5 seconds later, she's got a forum on a women's only forum, all right, on Wednesday afternoon from 2 to 4 to talk about issues directly related to women, okay? That's at 3801 Market Street from 2 to 4 Wednesday afternoon, not too far away from here. And of course, she's got her AIDS concert on August 20th. Shameless plug, these are called shameless plugs, all right? On August 20th at the Dell, and that's pretty fabulous. If you've ever been to a Divas concert, it's like off the chart, all right? But it's all about educating folks about the around HIV, but the other pains that exist in our community, and there are lots, and they're plentiful, and we've got to address that. But some of you have heard this before, and I'm going to finish here. A change is not from the suites down. Change is from the streets up, okay? If it's not forced at the local level, okay, it's never going to move us, okay? It's never going to move us to put the right funding to make sure that there's universal access to testing, Doug. It's not going to force us to make sure that the appropriate resources, as the appropriations chairman, are not allocated to the issues that directly impact. If it's not being agitated at the bottom, it takes far too long to happen at the top. I'm reminded when the leaders met with President Roosevelt in the 40s, and said, Mary McLeod Bethune and all the rest of them, we want this, we want that, we want this, we want that. And President Roosevelt said, we want voting, and we want housing, and we want everything like that. And President Roosevelt said, you know what? I agree with you. 100%. I sit here as a disabled man in my wheelchair, and I agree with you 100%. Now make me do it. 20 years later, in the 60s, we made them do it. That did not happen the Voting Rights Act and Medicare and Medicaid, all that stuff did not happen because we wanted it to happen. It all happened because we forced from the streets up, okay, change. So I would encourage that it's still the same with this disease, hepatitis C. The lessons that we learn from HIV need to transform themselves to this fight. And here in Pennsylvania, if you ain't got nobody else, you got me. Thank you very much.
Thank you, Senator, for those remarks and for reminding all of us the importance of having these discussions and then also taking actions. I understand we have time for one more question, and I don't know if it's inside or from those who engage on the webcast. I understand we have the question here. Yes, question.
Yes, I'm interested in knowing more about how rapid testing for HCVs really changed the game in terms of linkage to care. I'll leave that up to you.
Well, I'll speak from a community-based level.
I think you have to come to the mic, unfortunately, because how has rapid testing changed the game in terms of testing and linkage to care? Thank you.
When we first started testing back in the 90s, early 2000, we lost so many people to care. Why? Because we had to wait for the outcome. And between the time that we actually conducted the test to the time we found them, particularly in their, if they were higher risk, we lost too many. And to some we never found. But because of rapid testing, because it now gives us the ability, as it's been stated earlier, to give an outcome right then and there. And to, in our case, link them immediately to that linkage person. And to do the types of assessment and create a relationship, it has totally transformed not only how we do business, but how we encourage our providers to do business.
I think that's it as far as, oh, I'm sorry, we have time for one more. Okay.
My question is, Yvonne Cameron, Hepatitis Foundation. My question is, Hepatitis Foundation is very much concerned about the rates of hepatitis C, HIV among the incarcerated. And that is part of our hard to treat, hard to reach message. But we're finding organizations and others that aren't really willing to tackle the issue. But it's good to see that some of you here today are addressing this issue. What more can be done, or what more should be done in relation to engaging the incarcerated population, in which 90% of the incarcerated are released back into the community. So it's a matter of good public health. And so what more should we be doing, and can we be doing collaboratively to address this issue?
The question is, what more can be done to engage recently incarcerated persons to get tested? And should we be developing more partnerships? Anyone on the... I think, Dr. William, you speak about the incarcerated also? Okay.
Currently, we're in a conversation with the medical, a lot of systems are now hiring outside medical entities to provide services to inmates and to detainees. The conversation we're exploring right now is with that medical provider. We want to have them work with us to encourage sheriff's departments, for example, to allow us to come in, to build that relationship, and to provide screening on the way out. One of the advantages with this Gilead Project Focus is that this conversation would not be occurring. Why? Because it's an economic impact conversation. And unfortunately, we're dealing with systems that, because they don't have the resources at the legislative level that have been allocated for them, some of what Dr. Lee spoke of is phenomenal to me, that they can provide treatment that quick. And who's supporting it. And so we have to start building relationships with detainees who come in and out of systems. and use them as a vehicle and a voice, as it's been said, to be our messengers, if you will. So I'll just be quite frank. You know, even as we look at employment opportunities, we need to start re-engaging individuals who have been in the system, who know how it works, and pay them to do the job that we could probably never do.
Can you come to the mic, please? Yes.
See, y'all got me out here. All right. So, the correction system is a very difficult system to crack, okay? A lot of times folks in the correction system, has many levels to it. So a lot of times the folks in the correction system are afraid to reveal the reality that exists there, maybe because of liability issues or whatever. So the suggestion always is, if you can find a good, in Pennsylvania or in other states, a good correction secretary at the state level, all right? And you look at Pennsylvania's prison population, we have 48,000 people who are incarcerated in Pennsylvania. 49% of them are African American, okay? And they do recycle. Unfortunately. However, there are different points of entry. Our judges are extremely important in this process because at a point of sentencing, they can add in their sentencing testing issues and medical things that go along with that. But that's an issue of sensitivity, just educating them to what is going on. We have a, believe it or not, and I won't make this partisan, just for a point of alliteration. How's that, Doug? That's a nice big word for it. Early in the morning. The Republican portions, and I know our Congresswoman can speak to this, have grown in their concern about the rising costs of our jail system. All right. Now, all of that is stuff we've been talking about for a long time now. All right. But they're dealing with issues of rising costs. It prevents an opportunity to intersect with them to talk about that if we do progressive health care treatments before, during, and on their way out, okay, that we make it easier for those who are incarcerated to access Medicaid services and medical services on their way out, which you believe would not, I think, would be a problem, but it's a huge problem, all right? Just basic, you know, can I get a driver's license? Can I get a photo ID of some kind? If we work at that level to try to improve those systems, we can have better outcomes. But it takes a lot of intense work at every level of the system. Thank you.
Thank you. Thank you so much, Senator. And this is our last question, and it comes from someone who participated as part of the webcast. Why are the baby boomers, those born between 1945 and 1965, so impacted by Hep C? What went on during that time?
Okay, you've got part of the answer. But you know, I spoke at my church, and this was a big concern to many of the people in the audience who are in that age group because they don't have any history of risky behavior, and they're wondering why. So it's kind of not clear, but back in that time, we were not as consistent in testing blood products, and so some would be from transfusions. I also think that maybe being overseas during the wars may have had something to do with it. And of course, there are some who, like the gentleman that Dr. Leach spoke about, is now living a normal life, but at some point in their past had some connection with drugs or had some connection with someone who had been using IV drugs. But I think there's still some more information that needs to come out.
Thank you for your response. Let me thank everyone who participated in this discussion this morning, those who joined us by way of the webcast. I want to thank our panelists who made excellent presentations. And I want to thank our speakers, the Honorable Senator Hughes and Sheryl Lee Ralph, both of us who are still here. And I want to thank each one of you, and I certainly want to thank our partners who have made it possible, Gilead Science through their program, sponsoring of the focus programs, to OraSure for the quick testing, and everyone who has participated. I want to acknowledge that the Honorable Johnny Ford, who is Mayor of Tuskegee, had hoped to be here with us because they too are a major city in this southern tour, but he was not able to arrive here on time. So, to everyone involved, a lot has been said. We heard a lot about community partnerships. We heard a lot about linkage to care. And we also heard a lot about the importance of getting tested and getting treated. For there is a cure for hepatitis C. And we're just so pleased today on this Action Day that we have over 70 cities participating on some level as part of similar discussions that we have had here today. Let's go forth, keep the discussion going, but most important, let's take action. Thank you for participating.